Today we're talking about diverticular disease, which is an extremely common disease. Indeed, probably about 50% of people above the age of 50 in a Western society have diverticular disease. The first thing to note is that there's a big difference between diverticular disease and diverticulitis. Diverticular disease indicates the presence of diverticuli in the colon, whereas diverticulitis says that you've got an infection of these diverticuli. Most people with diverticular disease never even know they have this, and we diagnose this during a colonoscopy. So a colonoscopy is where we go into the bowel, we have a look up there, and mostly you get diverticuli in that section of the bowel. This is how a normal colon looks, and if you do the colonoscopy, you see that, and that's how it looks during the colonoscopy. So what we see here are multiple pockets in the bowel. You can get them on the left side, or you can get them on the right side. You can get them anywhere in the bowel. Most commonly, we see them on this side of the bowel, on the left side, which is that side. So patients with diverticulitis often come in with tenderness and pain on this side, often also a fever, and they feel very unwell. But as mentioned, most people with diverticular disease never even know they have this. The other presentation of diverticular disease is with bleeding. Interestingly, mostly you either get diverticulitis, which is the infection of these little pockets, or you get bleeding. They very seldom occur together. Why do we get diverticular disease? And why do we get it particularly on that side of the colon? The reason for that is that the pressure in this side of the colon is increased. There's weak points in the bowel where the blood vessels go through the bowel wall, and if you get long-standing pressure, long-standing constipation, those little pockets pop out. So ultimately we're dealing in a normal colon with no pockets, so a nice smooth colon, there's nothing that can get stuck there. With diverticular disease, you get like a little balloon-shaped structure, and if you have hard stools or if you eat something specific, it can get stuck in that structure, and then you get infection and inflammation. The treatment of diverticular disease, if you've got diverticulitis, is with a clear fluid diet. Often you need antibiotics to settle the infection and the inflammation, but mostly patients recover within 2 to 3 days. Generally, I actually advise patients not to take antibiotics in the beginning of the infection. Stay on clear fluids, see how it goes. If the fever is high, if patients are very uncomfortable, we may need antibiotics. Normally we don't need to admit patients to hospital, but sometimes if there's high fever, lots of pain, obviously hospital admission is required. The only treatment which takes the diverticuli away is surgery. Very few people need surgery, so less than 1 in 100 will ever need surgery. It's a very funny disease. I've seen thousands and thousands of patients with diverticular disease, and the absolute minority of them ever come to surgery. When would we consider surgery? We consider surgery when patients are very unwell, if they have very serious infections, high fever, and recurrent infections. The problem with severe diverticular infections, severe diverticulitis, is that sometimes it can form an abscess here. So you get stool and material stuck there. It's very high in bacterial content. It forms an abscess there, and then sometimes it can penetrate into the abdominal cavity. This is obviously a very serious problem. Patients do actually quite badly, so you've got to try and prevent that. So if a patient presents with multiple severe attacks, high fever, severe pain, then we must sometimes consider surgery. What we try and avoid is that perforation occurs. Perforation is a serious event. If perforation occurs, we need hospital admission, we need to stabilize patients, intravenous antibiotics, and then urgent surgery. So, to summarize, lots and lots of people with diverticular disease. Most of them never know they have this. We see it during colonoscopy where we get this appearance. Sometimes during colonoscopy there are so many diverticuli that you can hardly see where you are. And the risk of perforation during the colonoscopy is therefore increased. Sometimes we see patients who've had diverticular disease for 30 or 40 years, and during their first colonoscopy you see this, and they have no idea that they've ever had diverticular disease. If we need to perform surgery, and we can do it as an elective procedure where we decide this is a patient with severe diverticulitis, recurrent diverticulitis, we perform surgery, clean out the colon, cut the patient there, cut it there, connect those 2 points of the colon, and then patients do very well after that. That takes away the risk of further infection, further inflammation, but importantly, takes away the risk of perforation. If patients present, which is obviously unfortunate, with a perforation, severe infection, severe abdominal pain, then we need to still perform surgery, but then surgery is much more complicated. In those patients, we can't take out the infected part and reconnect it. We bring out a stoma, and then later we can reconnect the colon. So we try and avoid that at all costs. Basically, can we prevent diverticular disease? Probably not. A lot of patients think that you can control it and prevent it with diet. Once you've got diverticular disease, I think it's sensible to not be constipated. If you're very constipated, things get stuck there, so I always advise patients to use lots of fiber, perhaps get their bowels going with something like magnesium sulfate, old-fashioned Epsom salts. Some dietitians recommend that you don't take seeds or nuts with diverticular disease. I'm not sure that I fully believe that. For me, the most important aspect of diverticular disease is to be aware that you've got it, to treat properly if you do get inflammation or infection, to discuss with your doctor, to think about surgery if it's very severe and there's a high risk of perforation, and to try and avoid constipation. Importantly, in patients with severe diverticulitis or diverticular disease, you'd be very careful doing a colonoscopy. As you can see here, all those little pockets are there, and that's the opening where you've got to go through with your scope. So scoping a patient with severe diverticulitis is not indicated. Normally when you've had an attack of diverticulitis, you wait at least 6 weeks before you scope them. We normally need at least 1 scope with diverticular disease to exclude other pathology. But remember, if you've got severe diverticular disease, the colonoscopy can be pretty risky and much more dangerous than a normal colonoscopy.